I think as a GP I see obviously all sorts of patients, men and women, and one of the things I notice is that men process their health concerns differently to women. Men, as we know, are more likely to smoke, they're more likely to drink, and as a group they die younger than women, and that in this day and age, if it's preventable in any way, is unacceptable. And so that's why I'm behind the concept of Men's Health Week. I think the key is about how men access healthcare and trying to make it easier for them. Some men find going to the doctor the equivalent of how many women would find going to a mechanic's workshop and talking to a mechanic about their car. And that's got to change, so anything that we can do to make it easier for men to access healthcare is a good thing. There's a number of reasons why men die younger than women. Part of it is biological, for sure, but there are other factors. Men tend to seek medical help when it's too late compared to women. The other is that their habits, their lifestyle habits, tend to be worse. They're more likely to smoke and drink. And there is also a societal constraint that makes men feel that they have to be macho and just get on with things. And so that kind of adds to the fact that they don't seek help when they need to. I think online learning about health, if it's done properly, is a brilliant idea, because that is the medium of choice these days. More often than not, when you leave contact details these days, no one's interested in the phone or addresses. I mean, the post is just a thing of the past. Everything is done online. So yes, I think it's a really great tool for looking at information, partly because men can do it in the comfort of their own homes and privately, so they don't have to sort of be embarrassed about looking at things related to health. And I think it is a good way to actually sort of get to men who are hard to reach. I think in terms of what men look for most commonly online, erectile dysfunction must be one of the most common things that they look up, followed probably by drugs that they can order online, and sexual health I think is probably a big thing, because as a GP I notice we don't see a lot of men coming in with those kind of conditions, so they're clearly either going directly to sexual health clinics or they're not coming at all, and they're looking up things online.